Yeah, I notice when man, when I'm taking my shots, like there's like this pain in the front of my knee when I like at the end of the day where I'm like walking down the stairs.
So when you're taking your shot, so after you do a lot of shots, then you
Even
get the
like
knee pain.
even being in that like kind of like that down position, it's just like that hurts. Like it's just pain
Where?
in the front.
Point at it. Where is it at? Right in that,
Let me
kind of right below the kneecap area.
let me show you my ankles. Hold on.
Yeah.
There it goes. So like I guess my kneecap is here, but
Uh-huh.
right in front, right underneath it.
Kind of right. And if you go a bit further down, there's a little bump, a bony bump right down there
Yeah, right.
that it attaches to.
There's like this is like soft and squishy,
Yep.
and then here's like
Yeah.
bony.
Yeah. And then it's painful on the soft, squishy part,
It's
patella tendon.
cartilage grinding sometimes.
Yeah. Yeah. And so that hurts also when you're going downstairs after you're taking a lot of shots or after you have a day with you doing a lot of takedowns, stuff like that.
Yeah. Like I can't sit like this. I know like I'm bad squat form, don't judge,
Yeah.
but it's just like there's too much pain in there.
Yeah. So that's patella tendon. So as we go through there, that stretches out quite a bit. There's a couple of factors. One, it could be patella tendon overloading. So you might just get some patella tendon issues, kind of pain sensitivity with that. You also have a fat pad underneath there, which can also get painful and irritated if you get lots of compression on it. And there's also bursa in and around that area too, which can also get irritated. But with the bursa and the fat pad, generally we get some swelling. It sounds more like a patella tendon issue, especially if it's on stretch is when you're getting that pain. So with tendon issues themselves, what we tend to do is, well, when you're kind of looking at it, there's a couple different things that could happen. One, you could just have like general inflammation, irritation, which is like tendonitis type stuff. You could also have micro tears, a tendinosis. So over time, just that overloading, the fibers of the tendon start to kind of fray a little bit, and then it continues to overload, and you get that pain response. Or we can just get kind of like a hyperstretch, kind of an acute irritation on the tendon itself. And there's also the potential that tendon starts to pull off the bone a little bit, and you get kind of pain on around that bony part. So one of the first things we want to see is it more painful? So on that squishy part on that tendon, squish on both sides of it with your fingers. So kind of track it down from your kneecap and squish on both sides. And is it painful more so in the squishy part, the middle part of the tendon, or is it painful more part on that bony point where it connects to? So if you follow that tendon down on the front of your knee, there's kind of a bony ridge that sticks out. Yeah,
So here's my kneecap.
that's your kneecap. So if you follow it down, that's your patella tendon. That's the squishy part. You should almost feel like you could grab both sides of it. It's a band about an inch thick.
Yeah.
Yep. So if you squish that side to side like that, and on the front, add pressure, is that painful? Or so it could be painful. So is that more painful, or is it more painful if you follow it down? So keep going down that patella tendon, and it's going to run into a bony point on the front of your knee. You'll feel it. It kind of sticks out. It's a ridge, and it's right in the center. And that's the bone. That's where the patella tendon attaches. So if you push and rub on that point with your thumb and finger, especially right in the middle of it, is that more painful, or is the tendon itself more painful?
It feels like
More so the tendon
on this side in particular.
on the lateral side. And so with your knee bent like that, so the other thing we want to look at is that's also the joint line. So if you follow that back, so in that front area, we have the anterior meniscus portion. So especially as we start to bend the knee, if you're getting pain in that area, it could also be the actual knee joint. So with the knee bent like that, if you rotate your foot inside and outside like this, you're also going to rotate that lower part of your knee, the tib fib. So with your knee bent, I want you to turn your foot outside, and you should feel a little bit of that rotation. And does that change your pain at all? Does that make it worse? Is it the same, or does it make it better?
The same.
Same. Okay. Now do the same thing. Turn your foot inside.
Uh,
Same thing. Does it change your pain? Make it better? Same? Worse?
I would say same.
Same. Okay. Good. And then the last thing we're gonna do is you're gonna bend the knee fully. So as we bend the knee, it compresses the knee joint itself and it adds pressure onto the meniscus. And so typically we can kind of search around for kind of clicking, grinding on the meniscus itself. But what we want to do is I want you to fully bend the knee And then we're also going to track the joint line and see if we have pain on the joint line or if it's still in that kind of center tendon area, kind of off to the right side. Does that make sense?
Yeah.
So,
Okay, hold on.
so I'll show you here. So as we bend the knee, so we have our patella here, right? Patella tendon comes down and then attaches to this knee bony point right here.
Yeah.
So if you're getting pain more on this lateral side, it could also be the knee joint, or it could be this kind of patella tendon in this area. Also that fat pattern bursa are right under there too. But what we want to see is as we track the joint line, so right in that kind of ridge of the knee right off the side, if you move your finger up and down, you'll feel bone here, kind of a valley, and then another bone here.
Yeah.
This itself is the joint line. You can kind of just keep going up and down, and you can feel that ridge and that valley come all the way across. So what we want to do is find that ridge, that valley between those two bony points right there, hold pressure in the middle, and I want you to bend and straighten your knee like this and see, is there pain underneath right on that joint line, or is it still more this kind of patella tendon that we're squishing on and feeling?
My knee's bent and sit on that.
Yep.
On the outside.
Yep. So kind of the area where you're feeling the most pain, you said, is more on the outside of the patella tendon spot. So as you rub up and down, you'll kind of feel the bone on the top and the bone on the bottom, and that's your knee bones coming together. That's the joint. So you're literally feeling the joint ridge where it'd sit right here. Yeah. And you'll feel it kind of, it dips down. There's almost a valley between the bones. That's what we're looking for. So right in the middle of that valley, that's your knee joint line that comes all the way across. So if you rub up and down, you can kind of come across it and you can feel that joint line. And so what I want you to do is find that joint line just to the outside of your tendon, kind of right in there. That looks like you're kind of right on the money.
Yeah.
Maybe a little bit more to the outside. So keep going around.
There's like a
kind of like the right in there. Okay. So it's kind of on the front side. It's somewhere in the middle. It's not exactly the side, not exactly the front. It's kind of in between, almost on that kind of corner of that knee. Perfect. Yeah, right in there. That looks about right. Okay. So I want you to, on that knee joint itself, so you're going to add your thumb pressure, and you're just going to take a little bit of pressure. And then what I want you to do, so you find that spot, for me, it's right here. Hold pressure on that knee joint line, and you're just going to bend the knee and straighten the knee. As you bend it, you'll feel that gap open a little bit. So that ridge opens, that joint line opens in the front. And as you bend and straighten, just add pressure on that. And is that more specific where you're feeling the pain, or is it still more on this actual patella tendon that we figured out earlier?
It feels like it's like inside, like
underneath the knee joint itself.
Yeah.
But does that, so that feels like your symptoms that you're feeling, your pain when you're doing the shots or when you're walking down the stairs, or is it
when
just
I'm
irritated in general?
I'll try to repeat the motion. Like here, it's like
yeah,
it just like hurts
on the outside as you compress through there.
Yeah, like the top, like front.
Okay, so we're probably dealing a little bit more with a patella tendon issue. Okay, so that your quad muscle comes down the front of your thigh, comes over the kneecap, and then attaches down on that bone. Okay, and as the quad gets to your kneecap, the top part of it, it starts to turn to tendon, and that tendon runs over the kneecap and then attaches to that bone down on that front point. So let me show you again. So you have quad muscle turns to tendon right about here, and then it comes over the kneecap, and that tendon comes down, and you get this patella tendon that comes over the kneecap and down through here. As you stretch, as you bend the knee, this patella tendon has to stretch, and there's a lot of force that gets put on it. And so what can end up happening is over time, if we're overloading it, or if we get a little kind of micro acute injury to it, that tendon has less of a capacity to handle that stretch. And so what will happen is the fibers themselves, if we get a little bit of a damage to it, especially if this is a built up problem, not like an acute injury, the fibers themselves, they get a little bit of damage, and those fibers pull really strong in one direction. They're all parallel like this, okay? And so what happens is if you overload it, we get a little bit of kind of a micro tear. And so that tendon, if this is 100%, we get a micro tear. Now it's at maybe 95%. So we keep loading it. It has less capacity to hold up with it. So we get a little bit more tearing. Now it's at 80%, and then it gets going. So we get this kind of negative spiral where the more we overload it, the less capacity it has to deal with the loading we're putting it through. And it gets in this cycle where you get this irritation. It's going to start to let you know, give you pain, especially when we're putting it on stretch, pulling on those damaged tissues. It's called a tendinosis. I guess like the actual term for it. So what do we do about it? So especially if this is kind of a chronic thing, it just builds up. It wasn't like you took a shot, your knee popped, and now you have all this pain in the front of it. It's just kind of this nagging ache, especially if you can still do the shots without huge spikes of pain. And then afterwards, it's lingering, walking downstairs, sitting with your knee bent.
Exactly.
A lot of times they call this like theater knee too. So a lot of kind of patella femoral issues, stuff like that. But what we do about it is that tendon, the problem is it's overloaded. So we have to just build the tendon back up. And usually that it'll hold the pain response at bay and it'll be just fine. Tendon loading itself, we go through a very specific progression, starting with isometrics. Then we go to concentrics, then we go to eccentrics, and we progressively overload that tendon. So we stimulate those fibers that are damaged to realign, reheal, and rejoin the rest of the tendons in the force line. And so what happens is when they get injured, the fibrils will kind of reattach, but they're haphazard. So instead of being nice and parallel and flush and smooth, and they look at this in ultrasound research, instead of being nice and smooth and pulling in a parallel direction, the damaged fibers, they reattach, but they're haphazard. So they're still not quite as strong as they should be. And how we reorient those fibers so they start to align and become parallel again is we put load through them. And we put just enough load through them that it can handle it. And it's going to, that force line is going to start to guide those fibers into where they need to be strong and pull on, but we don't overload it to where they fail and they damage again. So we end up finding this Goldilocks zone is what they call it, where we load it just enough that we stimulate the fibers, but we don't overload it to where it damages them. And so that progression of isometrics, concentrics, eccentrics works really, really nicely in order to get the pain levels down, start to orient those fibers, and then get you back to kind of a full capacity tendon, okay? So what that looks like, so where do we start with it? That patella tendon, we get force on it stretching-wise when the knee's bent like this. So it's got a passive pull on that tendon. And when we contract the quad, so when we straighten the knee and shorten the quad muscles, it also pulls on that patella tendon. And so what we do is we start with quadricep isometrics, which will pull on that tendon, and it's going to give that force line that we want. And so literally what we look for and how we know to progress is pain-free, full minute holds. So what we start with is just locking the knee out. So sitting here like this, let's walk through this and let's try it and see how it feels. This also really helps. Isometrics helps pull the pain levels down. So if you're having knee pain after stuff like this, running through isometrics can also help manage the symptoms, get the pain levels down to help you to load it a little bit further to kind of pull you through the rehab. So sitting there, that's perfect. Do you have any pain in the knee at the moment?
No, just tight hamstring.
No, just tight hamstrings. Perfect. So with this, that's a good sign. So what we're going to do is you're going to lock your knee out. So try and straighten it out as hard as you can. Pull your toes back towards you. So your whole foot comes back.
Oh, this is tough.
And so, yeah, so you should feel that quad tighten up quite a bit. And then you're going to lift your leg off the ground. Okay, so you're getting the quad at the knees. You're also getting the quad at the high hip flexors. And you're going to hold it for a full minute, squeezing as tight as you can.
Should I do both knees?
And so,
what do I do?
No, just do the one knee. Just do the one knee that's affected right now.
Please hold.
Yep, we're going to hold it for a full minute. And so what we're looking for is, one, the muscles are going to burn and they're going to get tired. That's fine. What we're looking for is that you can hold this for a full minute without a pain increase in throughout that tendon. We know that your tendon itself gets painful when we stretch it, but we should have the capacity to contract through the tendon itself without this pain as well. So if we can hold this for a full minute, we don't have pain, we're kind of clear to start to move on to the concentric phase of things. And we find that level that it can hold without the pain response. And for you, with this, kind of looking at it symptom-wise, what's going on is probably concentrics are also going to be fine. And then eccentrics is going to be that level where that tendon kind of, it's the highest load on the tendon besides kind of plyometric shock loading, which is that last step. That eccentric is probably going to be where we're going to get a little bit of a pain response. And that lets us know that's where we're getting to a point where we're overloading that tendon. And so that's where we start our work and then we progress you through it. So how long are we through the minute? Full minute?
Yeah.
Any pain in the knee?
Towards the end, a little bit started coming.
Towards the end. Okay. So that level then, so if we get that little bit of a pain response towards the end of that minute, that's where we're starting to get too much loading through that tendon, and it's going to start to kick off and let us know. Okay. It's also a little bit acutely irritated, but this is the level then where we would start. So not even 2 eccentrics yet. So what I would start with is, for you, is you would do 3 sets of 1 minute of this knee isometric hold. So you take a small break like right now, then you start again. So you get about 30 seconds of a break. Then you go back into your full minute, and we do 3 sets of 1 full minute. Okay.
I'm listening, but I'm gonna just.
Okay, good. Give it a start. And so what would happen is typically it's over a week to 2 week period that we're going to see the jumps between each phase. Okay. So we would focus on isometrics for about a week time frame. You do 3 sets of 1 minute as a warm up every time before you do a workout, before you go to wrestling, before you're lifting, before you're running, whatever you do. 3 sets of 1 minute always to get this tendon kind of moving. And as you go throughout the whole week, you'll start to find that 1, the 3 sets of 1 minute gets easier. 2, that pain level isn't there at all, or it's improving and getting less. And once we can do 3 full minutes without any pain response, that's when we start the concentric phase. We jump to that next section. So for you, probably be about 3 to 5 days on this, and then that pain level with this is going to go away. Still with wrestling, still with eccentric loading, stuff like that, coming downstairs, you'll get a little bit of a pain response, but the overall levels will improve. Okay, so how did that set feel?
Pretty good towards the end, like last like 5 seconds, like I started feeling something.
A little bit of pain. Okay, so we'll do one more. So about a 30-second break, which is about what we had as I've been yapping my mouth. And so one more set, 1 minute hold, lifting the leg and loading the tendon up.
I feel it all in my quad. My quad gets so tight.
Yeah. Well, your quad's doing a lot of work. That's the point, is we want that muscle to do the work, and it's putting that force through the tendon, because that tendon transmits the force to the bone. So one last set. Okay, full minute. And so as we hold this is the initial part of our rehab, kind of, it's the exercise basis of it. There's other things that we can do to offload that tendon, so we can work on the quad soft tissue. So if we have any tension or tightness in it, it's going to add tension to the system and transmit it to the tendon. So if you're tight in your quads, which we can test your flexibility next, we can look at that. That'll be another portion of this that we want to do. So making sure that we're treating the soft tissue of the quads to add slack to the tendon system. That will help a lot as well. And also the joint itself, we can do some tricks with the joint to help bring the pain level response down and just give a bit more space to that tendon, helping blood flow, helping release kind of any swelling that's in there, any trapped stagnant fluid, things like that. We can get all that out and have fresh blood, fresh fluids, fresh swelling come in that kind of helps maintain that healing state for the body to repair. All right, so that's 3 sets. How'd that last set feel? Any symptoms towards the end?
Not towards my knee, but my quads are just dead.
Quads on fire. Good. Okay, so 3 sets of 1 minute. So that would be our starting point, because we have that little bit of pain. It will resolve quickly with this. So this kind of first 3 to 5 days, do this as a warm-up to anything that you do, or just generally throughout the day, once or twice a day. And that pain level in the knee will come down, and then soon you'll be able to do 3 sets of 1 minute, no pain at all. And you'd be ready to progress to that next phase, that concentric phase, where we start to load the knee and that tendon through movement instead of just holding a position. Same principles would apply. That concentric phase, we load it in a certain way. We complete that until we can do that concentric phase without pain. And then we're ready to progress to that eccentric, which is the muscle itself is having to control load while it's lengthening. So that looks like going downstairs. That looks like controlling squats. So as you squat down, the quad's having to stretch, and it puts tension through that tendon. Things like that are going to be that last concentric phase. And then you start to look at plyometrics, jumping, running, quick reactive reflexive type stuff. And that's going to be that hardest, highest level for that tendon. So the idea is that tendon itself should have the capacity to really kind of reflexively stretch and contract a whole lot under your body weight, in wrestling, grappling sports, under other people's body weights too. If it doesn't have that capacity, you're going to get those kind of micro injuries, micro tears, and you're going to start to see some of those injuries come on. So wherever that pain threshold is, you move backwards. For you, it's just isometrics. Then we start to build back up through those phases: isometrics, concentrics, eccentrics, plyometrics, dynamic reflexes, and you'll get your tendon back to full capacity. You'll strengthen the muscle of the other surrounding musculature. The joint itself will be more stable, and you'll be able to get back to wrestling, taking shots, controlling people, taking people down, things like that, without that knee tendon giving you a little bit of an issue. So in general, that's what we're looking at. The other tests we can do, because we want to treat the joint, we want to treat the soft tissue, and we want to treat the tendon itself, which is a part of the soft tissue. And so the other thing we could look at is if your quads are also contributing to the tendon. Suppose your quads run into your tendon. If your quads are tight and it puts tension on the system, that tendon's always on stretch. And so those forces that kind of pull on it at the end, that can also be a cause of those kind of overloading it as well. So quick test for that. Let's see how tight your quads are. So if you lie on your stomach and then turn to the side, so it's your right knee. So turn towards your right knee is facing me.
I charged for this.
Yeah. Perfect. And then lying down like this. So what we want to do is, first off, just with that right knee, try to bring your heel as close as you can to your butt. Good. And we got about a hand, thumb to pinky. And so what we like to see is about a fist, okay? Because you're going to kind of run into your hamstrings, but we like to see a fist. So you have a little bit more movement to go through. And if I was there and I could jam on your heel, I could probably get your heel to your butt. But your active control, so what your hamstrings can do, exactly, right? So your hamstrings can get your heel about 2 fists away from your butt. If you jam on it, the actual range of your quad and your knee, you can get your heel all the way there. So that missing portion of that range, it still has the capacity to get there, but you cannot control it. So what's going to happen is when you get to those positions where that quad needs to release to get that knee fully bent, which looks like that takedown position that you went over, those, the duck walks, the rock over steps, the penetration shot on your takedowns, that position is going to stretch that quad to a point that you can't control it. And that's when you start to get these kind of overloading cycles start to happen. So the other portion of this, not just building the tendon back up to have the capacity to handle it, the other portion is getting your quad length to improve so that you have full control over that whole range. Does that make sense?
Yeah.
So the other piece of this is quad soft tissue work. And so one of the favorites is just barbell. A lot of people use foam rolling. I like to use barbells. So just like we've done before with some of that soft tissue work, place a barbell on your quad sitting down just above your kneecap, and we're going to shear across the tissues, forward, back, side to side, and then we're going to straighten and bend the knee underneath it. And so we're going to ask that quad tissue to compress, contract, and relax underneath the pressure, and it will release it off. Yeah, grab a barbell and walk through it.
Have this, just hanging around.
Yeah, just a barbell hanging out. It's nice. So joining everybody else, we're just going through some knee pain stuff, how to manage anterior knee pain, patellar tendon pain.
Okay, there.
Perfect. So what I would do, pull the barbell on the other side of you so it's more on the outside, and then the pressure is coming in towards the middle.
I'm going to have to.
So thanks for joining, going over how to help manage some anterior knee pain with takedowns, level changes, shots, going up and down stairs, day-to-day stuff. Okay, so the more that you have the barbell towards your left side, the more weight that's going to be on it, right? And the more it's to the left, the less weight. So pretty much you want to pick a level that's manageable but doable. So it should be uncomfortable, but it's doable. We're going to start with a barbell towards our knee. So you're going to come right above your kneecap, okay? And then you can add pressure on top of it, okay, if you need. So with that there, you're going to hold the barbell and you're going to kind of shear it across your muscle tissue side to side. And just like that, we should see that skin tack to it and the whole system moves. And this sometimes feels a little bit uncomfortable. That's what we're looking for, okay? So you're going to go side to side 10 times.
Just like moving the knee a little bit.
Yeah. It's good. We want all of that soft tissue to start to move and free up. And then you're going to go forward and back, kind of scraping up and down 10 times. Not running into your kneecap, though. That's your limit. But kind of pulling the skin up. So you go back and forth 10 times.
Did I rotate my leg as I'm doing this?
Nope, not yet.
Okay.
How's that feel?
It hurts.
Nice Friday morning activity for you. Okay. And then after we do up and down 10 times, now we're going to hold that pressure. And this is where you can rotate your leg and you're finding the most sensitive area. So rotating the leg, usually as you rotate it inwards, the outside of your quad is going to be a little bit more sensitive than the inside typically, but you might have both. So what you're looking for is you can kind of twist your leg and you're looking for the most sensitive area, outside, middle, or inside. It might be all of them. Okay.
And just hold it.
Whichever one's the worst, you're going to hold it there, find that spot, and then now you're going to contract your quads. So you're going to try to straighten your knee out as hard as you can.
Yep.
Good. And then we relax, and then we're going to do that 10 times. Okay. On that sensitive spot. So it's 10, 10, 10, shearing side to side, 10, forward and back 10, contract and relax 10 on that sensitive area. And then we divide the quad into 4 quadrants, okay? Quad into quadrants, 4 sections from the kneecap all the way up to the high hip, because your quads comes all the way up and it attaches on this front hip bone, so it comes all the way across the hip. So we're going to go from the knee. We do this one kind of 10, 10, 10, and then we're going to roll the bar up the quad, and it kind of pulls the skin with it. So we roll it up to that second section, that second 25% section that we divided it into, that second quadrant. And we do the same thing, side to side, forward, back, contract, relax underneath it on the most sensitive area, outside, middle, or inside. If it's all 3, then you should be doing all 3. We're just looking for the most sensitive areas, any tension in the muscle, any sensitive spots, and then we're going to treat the muscle underneath it. This itself, as we build from the kneecap all the way up to the hip, it'll help that quad muscle just relax a little bit. Any kind of contractile units that are holding on, it'll start to relax a little bit more. And so then we'll gain more length out of it. So as you do this, we can then go back, retest your knee bend on your stomach, and we should see a bit of an improvement in that knee joint flexion. This whole purpose of all of this is that quad muscle tension does pull on that patella tendon. So if we can slacken the quad muscle, it gives release and relief to the patella tendon, and it helps with that rehab process, managing the symptoms, bringing the pain levels down.
This hurts.
Good.
I moved
Good.
it up. I moved it up a little bit because I finished the 10. Now I'm hitting the shearing.
On the next one, good. Well, you're doing a good job suffering in silence over there, so well done.
Yeah. This hurts.
Okay, we got that 3rd section. Once you do this one, we'll go through that 4th, and then we'll retest the knee. But overall, this would be kind of that starter plan for you. That first week, maybe week and a half, this should bring your pain levels down substantially. Treat the soft tissues of the quads like you're doing, and then do those 3 sets of isometrics knee holds as warm-ups before your activities, and that knee pain threshold should come down substantially. Then you start to progress onto the other phases, and it'll help kind of build that tendon capacity back up and get rid of this pain over the long run.
Get rid of pain with more pain.
Get rid of pain with more pain. Temporary pain for long-term relief. That's right. It's the good stuff.
Okay, so now
All right, where are you at on this? You on your 3rd section?
I'm finishing up the squeeze holds on the 2nd section.
All right. So keep going through, do those other 2 sections, and then we'll retest your knee bend, and that'll probably bring us to the time frame that we have. So another 5 minutes or so.
No, thanks for having me.
What do you say?
Thanks for having me on here.
Yeah, thanks for jumping on. Makes it much more lively. Hey, real ready. Thanks for joining. We're going over anterior knee pain, how to ease it off and how to build it up. Good. Couple more sections.
Towards my, not away from it.
Hurts more towards the knee?
Yeah. Maybe I'm not putting enough weight.
No, I think that's pretty typical. Further down towards the knee, it typically is a little bit more sensitive. Pretty standard. Some people, it's opposite though. It hurts as you come up higher in the quad, but typically that's people that have more tendon issues at the insertion point. So that high hip where that quad starts, you can get tendon issues there, kind of hip flexor pain in there. Typically people with that have more sensitivity at the higher parts of their quad when we're doing this kind of soft tissue work like this. So it just depends. But with patella tendon, more typical that it's painful further down towards the kneecap. So, and feel free to add more weight. Manageable and doable is what we're after. Pain threshold wide, 10's the worst you can imagine. 0 is nice and comfy, none at all. Pushing stuff like this into the 4s and 5s is okay. You're not going to do any damage, and it's not going to set off any kind of sensitivity spiral. Anything past that, you tend to see this kind of retraction. The muscle kind of tenses up. It's too much pain, it's too much to cope, and you kind of get this spike in sensitivity. Pain levels afterwards get a little bit worse. So 4s and 5s are okay, and we see improvement. So with that, once you push past that, it tends to be too much. So do as much weight, as much pressure as you can into that kind of 4 or 5 pain threshold is what we're going after.
4th quadrant.
Good. 4th quadrant.
Wait.
Excellent.
So that should be towards my hip more, or?
Yeah, pretty much as high as you, because you're sitting, you'll be kind of at a 90-degree angle where your body, your trunk meet your quad, your leg coming down. So pretty much as high as you can get up there, and it's going to be kind of on the very, very high hip part, almost right below your waistline.
Got it. I think
So as high as you can get it up there.
I did. I did.
That's all right. Yeah. And with this too, the whole idea is like we cover the whole quad pretty much, but you're looking for the most sensitive areas. So as you would do this as part of your warm-ups to your workouts, you can start to play around and experiment with different spots. Some people will find like the lateral portion of their quad is the most sensitive and it's almost unbearable. That's the spot that you need to work on. So then some people just start doing this on the lateral quad, vice versa on the inside. Some people just do the inside portions or just the middle. But you kind of have freedom just to play around. And really at the end of the day, as long as you're going after the most sensitive kind of responsive tissues is a good word. So what feels the most, that's kind of where you need it the most with the compression and working underneath it. So there's no wrong way to do it. Just go after what's most sensitive.
I guess this will be my last one, so we can go to the retest thing.
Last one. Okay.
No, I definitely feel this all the way up through my leg.
Good.
It hurts.
It'll be good to do all the three legs.
Have you seen that?
Good.
Ben Gay. It's so good.
It hurts so good. Yeah. That's what we're looking for.
All right.
So in general, after that, that should help your kind of knee move a little bit freer, should feel looser. And actually, if you retest that kind of takedown position where you're getting the initial pain, that pain level should also come down. So if it was a 4 or 5-ish before, whatever it was, I didn't ask, so I don't have a number for you. But whatever it was before, if you retest that position, say it was a 5 before, it should drop kind of into like a 2, maybe 1. That pain should improve. It'll still be there, but it should feel a little bit nicer than it was before.
Like you're right. It feels like way smoother. Like I can glide through.
Yeah. So that's a good thing. So it'll still be there. So you'll still feel that little bit of hit of pain. That's normal, but it should help to manage the symptoms come down, which allows us to then load into those positions with isometrics and other exercises to help load the tendon in a way that's not so sensitive and so responsive. So now let's lay on your stomach. Let's retest your knee bends. Should see a slight improvement in it. Won't be miracles. You're not going to get your heel to your butt, but you should see an improvement overall.
Yeah.
So we test maybe a half of a fist improvement. So we got about 5, maximum 10-degree improvement, but we still see the range does get better. And so that quad muscle is also contributing to some of that limitation in your joint itself. So what you're shooting for with this is normal, as we should see about a fist between the heel and the butt. And that tends to be a really good range of movement in terms of preventing and avoiding some of these overloading issues in terms of active control. Of course, it's better if you can get your heel all the way to your butt, but it's not very common that you can. Typically, you run into hamstrings and stuff like that, soft tissue hitting each other. But a fist is what you're aiming for. So as you improve this quad, working on the soft tissue and some of the exercise will also help the control, especially when we get to the eccentric phase. That range of movement overall will improve, and it gives the tendon the full ability to stretch and contract in a normal range of movement. So it's not overstretching. In terms of your knee, it would take kind of probably 3 to 4 weeks to get from where it's irritating you right now, because it's not that bad, to you're not going to notice the knee anymore. And then probably about another 4 weeks to really build up the strength, and then it'll feel rock solid. You won't have to worry about it whatsoever. That's the phase that you go through. Start with isometrics, 3 sets of 1 minute like we did as warm up before your workouts. Do the soft tissue work first that we worked on, that quad barbell. So do the barbell stuff first, then do the 3 sets of 1 minute of the quad contraction, then go do your workout. Pushing into pain levels up to 4 or 5 is okay during your workouts. If it lingers afterwards, like you're saying afterwards you get pain coming downstairs, up to an hour, 2 hours is okay. If you're starting to get lingering pain for longer that, we're still overloading it a little bit too much. So you might have to just modify parts of your training. So if you're doing, drilling and you're doing 5 sets of 5 minutes of takedowns and your knee starts to bother you, do 2 sets of 5 minutes of takedowns and see if that loading doesn't help that lingering go away. So don't stop activity completely, but just change it so we bring those overall volume levels down until we get those pain levels under control, and then we build them up. So that's what I would say for you. Over about a week, start doing the soft tissue work, 3 sets of 1 minute holds. Your pain level should come down substantially. They'll still be there a little bit. And once you can do those 3 sets of 1 minute without any pain, then you're ready to progress on to that concentric phase of things where we start loading the tendon a little bit more through a more challenging type of exercise. And we start to stimulate that tendon even more to build up, and that capacity overall improves. And so that would be kind of that general intro program. That's what you would do and work yourself through. And it would take you kind of 1 month to 2 month time frame to get back to full knee, full capacity, not worrying about it whatsoever.
Cool. No,
Yep.
this is going to be the next thing that we work on.
Yeah, exactly.
After my shoulder, we're going to be.
Perfect. Well, you got the intro, so start working on it right now, and then it'll make it a lot easier. We'll hit the ground running when we get to the knee.
For sure. I'll stop your life.
Sounds good, man.
But this is good.
Good. We're glad it helped. Anybody that watched, if you have any problems, stuff like that, let us know. Send me a message afterwards. Help Doran. But this is the anterior knee pain, lateral, medial knee pain, inside the knee joint, all the stuff that we can work on. Let us know if you have any issues with it. Next week, we're going to do another kind of live Q&A like this. If you have problems, injuries, stuff you want to go over, just hop on. We can kind of do a quick live assessment and kind of intro stuff to get your pain under control. But afterwards, thanks for joining. Just as a reminder, so for next week, on the 19th, so I guess 2 weeks, on the 19th of November, we're doing another online live workshop. And what we're going to go over is actually our hip mobility. So what we see a lot of times is people grabbing triangles because your hip has to turn, no problem, Doran, because your hip needs to rotate in order to get to the triangle. If the hip doesn't allow you to get in that position because you're tight or tense, we see forces go into the knee, and so we get a lot of kind of lateral knee pain, knee issues with that. So then November 19th, we're going over a workshop, how to improve your triangle, the position that you're getting into. You'll be more successful getting your triangles, and how to free your hips in order to get into those positions. So we're going to go over 2 or 3 good mobility exercise mobility drills in order to loosen up your hips overall, in order to help you free yourself and get into better positions for triangles, preventing knee injuries and other injuries down the line. So if you're interested in that, make sure and sign up. We have a link in our bio, and we'll be posting about it. So save your seat, join in. It'll be about a 45-minute workshop, and you just have to bring a band and a lacrosse ball, hard ball, foam roller, anything for kind of some muscle tissue release, barbell like we saw today, stuff like that we can help treat the soft tissue, and some mobility drills to open up that hip joint in order to improve our triangles. So it'll be online, it's free. Check out the link, save your seat, and then we'll go through that on November 19th. So thanks for joining today. If you have any more questions, feel free to send me a message. And then next week we'll be back on Friday as well, so you can come in and get an assessment as well. So thanks for joining, everybody, and hope this helps. Catch you later.